The Centers for Disease Control and Prevention is worried about lagging vaccination rates. In a health alert this week, it said vaccine coverage among kindergarteners has decreased, which has left 250,000 young students susceptible to measles.
The measles vaccine is safe and effective and really the best way to protect your child and to protect our community.
Vaccine is effective enough that you can rest assured you are going to be more than likely okay. And that risk is low, even if you were amongst a group of a higher percentage of a group that was unvaccinated, because you have that preventative and protective vaccine.
There is a very effective way to keep your child safe from measles, and that would be vaccination. That vaccine is called an MMR.
That message from doctors, health officials, and schools is especially important this year. Globally, measles vaccination rates have declined, increasing the risk of outbreaks. The CDC says most of the measles outbreaks that happen in the U.S. come from unvaccinated U.S. residents who travel. It's why the agency is urging schools, preschools, and healthcare providers to ensure students are current on their MMR vaccines.
Indiana is very specific in the law regarding school vaccination requirements. So any student, no matter what the grade, on their first day of attendance in school, they are required to be compliant or up to date on all of their immunizations.
That's Stacy Pavlovic, nursing coordinator for Concord Community Schools. Concord, like all Indiana school districts, requires students to be up to date on their immunizations. Schools can grant a 20-day waiver to allow a family to get caught up. There are medical and religious exemptions allowed in the state. In Michigan, children are also required to be immunized, but the state allows exemptions for medical, religious, and philosophical reasons. The state's chief medical executive says immunization rates in Michigan have dipped.
And that means that fewer of our young children are protected against diseases like measles or polio.
Michigan has 3 confirmed cases of measles within the past month.
Measles in particular is extremely transmissible. It's transmitted through minuscule airborne particles, and it has a very high attack rate. And what that means is that when susceptible individuals are exposed to measles, the vast majority of them develop the illness.
Measles can cause serious cold and flu-like symptoms, and for some people, it can cause severe life-threatening complications. Children are especially at risk. Health officials say the concern for a large measles outbreak here is low, but pockets of unvaccinated people could be at risk. School vaccine data offers some insight. This is a look at the latest percentage of immunization waivers in Michigan. The darker the blue color, the higher immunization waiver rates, meaning unvaccinated children could be more vulnerable there. In Indiana, the Department of Health dashboard shows during last school year, some schools and districts saw lower overall vaccination rates, but children immunized for MMR is higher. So what does this mean for your children?
And if your children are unvaccinated, yes, I'd be very concerned. But if your children are fully vaccinated, up to date on their routine vaccines, then there is no need to worry.
I'm John Paul. Thanks for watching. Here's another video for you to watch. Also, please take a moment to subscribe to our channel.